Anatomy is primarily a teaching department, and we focus a lot on undergraduate teaching. And we have a very good student cadaver ratio, and 10 to 12 students in a group dissect a cadaver, and for this we would wholeheartedly like to thank our donors. Besides learning anatomy by doing the dissection themselves, we are involved in creating lots of innovative teaching aids which help the students understand this difficult subject and make it more lucid. So for example, when we started off, we didn't have enough bones, and so we created these artificial bones. These are almost similar to the natural bones and have all the markings that are present on the natural bones. These are made of plaster of Paris, and we envision to create such fiber bones which would be unbreakable and would be easier to handle. Besides this, we are also involved in creating embryology models. These models are also prepared in-house, and they help students understand the very complex science of development of an embryo in utero. Okay, these models are very unique. We won't find them anywhere else because they have been thoughtfully created and planned and have been made under supervision. Our artist Mr. Farooq Khan has put in lots of effort to prepare these models very intricately. Besides this, we are also using such customized jars. These are specifically, we use them for teaching neuroanatomy because this is again a difficult subject to understand, and brain specimens are very fragile to use. So we put these specimens in jar, and these jars are handle worthy. They can be handled easily, and students can learn from them without destroying the specimen, and they can be used again and again. Histology diagrams, drawing these diagrams are students find them difficult, so we have prepared such histology cards, and these cards are contain drawings made by students themselves, and we label them and we use them as an aid for the students to help them drawing the diagrams themselves, and in the process learn the subject. Besides this, we have very unique models. For example, these we have pasted the ligament over here, and for example, inguinal ligament, the sacrotuberous and sacrospinous ligaments that are prepared, that we can show directly on the bones. This is a plaster of Paris model showing the cartilages of larynx, and we have some models made up of thermocol. These are thermocol sheet models. They are big models. They can be used in lectures, they can be used in practicals, and very easy to handle also. Okay. So besides this, we have also experimented with wet clay. For example, this is a wet clay, and we give such clay to the students and ask them to carve certain complex structures. For example, nuclei of thalamus, which are again difficult to understand. So we ask the students to carve the nuclei by themselves, and in the process they learn the spatial arrangement of very complicated nuclei of thalamus. So this is an experimentation we do. We are now envisioning to move to the postgraduates, help the postgraduates of different disciplines, clinical disciplines, and we want these aids and our department to help them out in their relevant discipline, the related anatomy that they would be, they would need the knowledge of relevant anatomy that they would need, so that we can help them out as well. Thank you.